presenting as food poisoning. Botulism, initially it was identified from the case of person who has ingested sauces. Literal meaning of botulus is sausage. जो हामी खान्छौँ sausage. Literal meaning of botulus is sausage. It is Latin word. First, it was identified from the person who has ingested sausage. So, according to Latin word botulus, the name of disease is called botulism. Causative agent of botulism, already I said, is bacteria named botulism. If we observe morphology of Clostridium botulinum, it is gram-positive bacilli. It is gram-positive bacilli. It is motile. It is spore-bearing. It has subterminal and oval spore. It is gram-positive bacilli. It is motile. It is spore-bearing. Shape and position of spore is subterminal and oval, but it is non-capsulated. So, in morphology of Clostridium botulinum, it is gram-positive bacilli, motile, spore-bearing, and non-capsulated. It has subterminal and oval spore. This bacteria, it is anaerobic bacteria. It is obligate anaerobe. It strictly requires absence of oxygen for its growth. It is obligate anaerobe. It grows on blood agar, nutrient agar, anaerobically, or in anaerobic culture media such as RCM, Robertson's cooked meat media. It can grow at 35 degrees Celsius. So, in cultural characters, for Clostridium botulinum, it is obligate anaerobe. It can grow in blood agar and nutrient agar anaerobically, or better, it grows in anaerobic culture media, Robertson's cooked meat media at 35 degrees Celsius. There are 8 types of Clostridium botulinum on the basis of indigeneity. On the basis of indigeneity, Clostridium botulinum, it is categorized into 8 types. Type A, B, C1, C2, D, E, F, and G. Among these 8 types of Clostridium botulinum, type A, B, E, and F cause human botulism. On the basis of indigeneity, Clostridium botulinum is categorized into types of Clostridium botulinum. Type A, type B, type E, and type F. They cause human botulism. Type A, B, and F are proteolytic. Proteolytic means if we grow type A, B, and F, Clostridium botulinum on RCM, Robertson's cooked meat media, they will produce black color. Proteolytic C, D, and E are saccharolytic. Saccharolytic means they will produce red color on RCM, Robertson's cooked meat media. Type C and D, they do not cause human botulism. So among type A, B, E, and F, which cause human botulism, they may be either proteolytic or saccharolytic. Type A, B, and F are proteolytic. Type E is saccharolytic. Now, pathogenesis. How Clostridium botulinum it can cause infection. Source of infection is undercooked sauces or wounds or soil. Mode of transmission, mostly it is by ingestion. And mechanism, strains of Clostridium botulinum type A, B, E, and F, they produce neurotoxin. Type A, B, E, and F Clostridium botulinum, which cause human botulism, First, how they will lead to botulism? First, they will produce neurotoxin. After ingestion of Clostridium botulinum, toxin is liberated during growth and during autolysis in gut. Botulinum toxin absorbed from gut and binds to receptors of presynaptic membrane of motor neurons of peripheral nervous system and cranial nerves. Botulinum toxin, it is absorbed from gut and binds to receptors of presynaptic membrane of motor neurons of peripheral nervous system and cranial nerves. It will lead to inhibition of release of neurotransmitter, mostly acetylcholine. It will lead to inhibition of release of neurotransmitter acetylcholine at the synapse, which will lead to lack of muscle contraction and symmetric descending paralysis. Death in botulism is due to respiratory paralysis. This is general mechanism of pathogenesis. But there are three clinical types of botulism: foodborne botulism, wound botulism, and infant botulism. So, mechanism slightly differs in different clinical types of botulism. There are three clinical types of botulism: foodborne botulism, wound botulism, and infant botulism. Foodborne botulism, it is paralytic disease caused by ingestion of preformed toxin in food contaminated with Clostridium botulinum. Foodborne botulism, it is paralytic disease caused by ingestion of preformed toxin in food contaminated with Clostridium botulinum. Incubation period for foodborne botulism, it ranges from 12 to 36 hours. Remember, hours. Incubation period ranges from 12 to 36 hours. Symptoms of foodborne botulism includes vomiting, thirst, constipation, visual disturbance, dysphagia, difficulty in swallowing, difficulty in speaking and breathing. Foodborne botulism, mostly it is due to ingestion of contaminated sources. Incubation period, it ranges from 12 to 36 hours. Symptoms include vomiting, thirst, constipation, visual disturbance, dysphagia, difficulty in speaking and breathing. It will lead to flaccid paralysis. Due to paralysis of cranial nerves, there will be weakness of peripheral muscles. There will be weakness of peripheral muscles. There will be urinary retention and respiratory paralysis and ultimately death. Due to respiratory paralysis, death may occur in foodborne botulism. Other clinical type of botulism is infant botulism. There are three clinical types of botulism: foodborne botulism, infant botulism, and wound botulism. First, foodborne botulism, that is due to ingestion of sauces, contaminated sauces. Next is infant botulism. Infant botulism, it occurs due to feeding of honey. Remember your MCQ માં શોધના શકશો. Infant botulism, it is due to feeding of honey contaminated with the spores of Clostridium botulinum. Infant botulism occurs due to feeding of honey contaminated with the spores of Clostridium botulinum. Spores germinate in gut, multiply, and produce toxin. It is seen in infants below 6 months age. Infant botulism, it is seen in infants below 6 months age due to feeding of honey contaminated with the spores of Clostridium botulinum, but it is not seen in older children and adults. Features of infant botulism, they are poor feeding, Clinical features of infant botulism, it includes poor feeding, weakness, and signs of paralysis. There will be poor feeding, weakness and signs of paralysis, constipation. There will be constipation. There will be pooled oral secretions. Pooled भनेको यो थुकको फिजहरू मुखको ओरल सेक्रिसनहरू pooled भनेको जम्मा हुने. Pooled oral secretions, and there will be altered cry. So features of infant botulism includes poor feeding, weakness and signs of paralysis, constipation, pooled oral secretions, and altered cry. Other clinical type of botulism is wound botulism. First is foodborne, second is infant, third is wound botulism. It results from wound infection with Clostridium botulinum. Wound botulism, it results from wound infection with Clostridium botulinum. Toxin produced by Clostridium botulinum at the site of wound infection is absorbed in blood. Toxin produced by Clostridium botulinum at the site of wound infection is absorbed in blood, and neurological manifestations occur. Except manifestations such as difficulty in swallowing, speaking, breathing, delirium, coma, and death. Wound botulism, there will be, it occurs due to absorption of toxin in blood through wound where Clostridium botulinum releases toxin, and neurological manifestations occur except manifestations such as difficulty in swallowing, speaking, breathing, delirium, coma, and death. So these are three clinical types of botulism: foodborne, wound, and infant botulism. Now, how will perform lab diagnosis of botulism? Lab diagnosis of botulism, diagnosis is done mainly clinically by observing clinical features, but for lab diagnosis, for confirmatory diagnosis, we have to perform lab diagnosis. Lab diagnosis, it can be done by demonstration of toxin. It can be done by two methods. Lab diagnosis of botulism it can be done by two methods. First, demonstration of toxin. Other, demonstration of bacteria in suspected residual food, patient's serum, intestinal contents, feces, etc. So one is demonstration of toxin, other is demonstration of bacteria. First, demonstration of bacteria. It can be done by gram staining. Clostridium botulinum, it is gram-positive spore-bearing bacilli. It is gram-positive bacilli which contains spore. Spores are oval and subterminal. By observing this morphology in gram staining, we can identify Clostridium botulinum. Other, we can perform culture of Clostridium botulinum. It can be done in Robertson's cooked meat media, RCM broth that you have seen. It can be done in Robertson's cooked meat media. Type ABNF, type ABENF, these four types of Clostridium botulinum, they cause human botulism. Type A, B, and F, they are proteolytic. E is saccharolytic. So, any type of the Clostridium botulinum which causes human botulism, from clinical sample of botulism, if we perform culture in RCM, Robertson's cooked meat media, we may get either proteolytic reaction, turning of RCM media into black color, or saccharolytic reaction, turning of RCM media into red color. RCM media may turn into black color. That is proteolytic reaction. RCM media may turn into red color. That is saccharolytic reaction. We may get any type of reaction in case of botulism. Other method for lab diagnosis of botulism is demonstration of toxin. First, we have to take sample, that residual food, vomit, whatever it may be. That sample is mixed in sterile isotonic saline, macerated, mixed, and filtered is divided into three parts. That filtered extract sample is divided into three parts. One part is heated and two parts are unheated. Remember, we have taken sample mixed in sterile isotonic saline, macerated and filtered. That filtered extract sample is divided into three parts. One part is heated at 100 degrees Celsius for 10 minutes. One part is heated and two parts are unheated. Then two mice are injected. We have to take two mice. Total we have to take three mice. Two among which two mice are injected intraperitoneally. Remember, we have to inject intraperitoneally. Two mice are injected which is protected with antitoxin. Third animal is injected with heated material. We have three samples. One mice is injected with heated material. Two mice are injected intraperitoneally with unheated sample. Among two mice, one is protected with antitoxin, other is not protected with antitoxin. Do you get it? Now, what the result we will see? In case of unheated toxin injected mice, in case of unheated toxin injected mice, there will be symptoms and death, flaccid paralysis and death. In case of unheated toxin injected mice in which we have given antitoxin, in case of unheated toxin injected mice, there will be symptoms and death, flaccid paralysis and death. In case of unheated toxin injected mice with antitoxin, it will be protected. There will be symptoms and mice will not die. But in case of mice in which we have injected heated toxin, there will be no symptoms. In this way, by demonstration of toxin also, we can perform lab diagnosis of botulism. Now, prophylaxis of botulism. Proper canning and preservation of food for prevention of foodborne botulism. Proper canning and preservation of food. We can give immunization also. There are two types of immunization: active immunization and passive immunization. Active immunization, it is needed for highly susceptible people, risk group people such as butchers, shepherds, lab staffs,